Well, certainly, when you think of other types of insurance, whether it's auto, life, or disability, nothing near this in terms of new things coming on the market and the cost of covering those as part of insurance policies, which is a good segue to think about the insurance marketplace generally and sort of the changes that we've seen and how that's going to continue to play out. We know that the ACA is changing who has insurance and who covers the insured. We're waiting for a Supreme Court decision on what that might mean for Medicaid in some states. Coverage is shifting away in some cases from commercial and employer-based coverage to Medicare and Medicaid, and healthcare spending, of course, will have implications. Art, with Excellus in New York State, my understanding is that you have plans that are participating as part of the exchanges. Maybe talk about that experience and your view of sort of how the exchange marketplace plays out, at least as you see it in New York State.
Sure. And first of all, for those who are not aware of this, New York State has its own exchange, and there are roughly a dozen and a half states that do. Others are part of a federal exchange, and there's some commonalities and some things that aren't exactly the same. But let's keep in mind the goal of the ACA. We had 50 million uninsured Americans, and it was felt there should be universal coverage. So the whole idea was to get coverage for those 50 million Americans and then to put additional reforms in there. And that's why for a while it actually had the moniker of health insurance reform. And frankly, some of those policies needed to be changed, and they're very good. What we have seen, though, is it's not just in New York State, but elsewhere. We've seen an expansion of Medicaid. We've seen an expansion of the individual market. And that's really important. Up until recently, an individual who did not have the option of employer-based insurance and didn't qualify for Medicaid or Medicare, for them to go onto the marketplace, well, they're basketed together with an individual who has diabetes and is on a transplant. It was unaffordable for an individual in many, many cases. So the individuals, this gave them entry into the marketplace that they never had before. Now, it was hoped that with this expansion that you would bring in a wider pool, the young invincibles, you know, that 25, 30, 35-year-old. Well, we've seen more of the 45, 50, 60-year-olds signing up, but not as many of the young invincibles. We've got to do that. If we're going to expand the pool and make this truly affordable for everybody, you've got to also have the younger people as part of this.
I was going to ask, one of the things that I have been concerned about with the exchange plans is the narrow networks, in the sense that most exchange plans out there have a relatively small set of providers that you can go to and otherwise is out-of-network care, which is extremely expensive. The American public did not respond well to last time we tried in managed care to try to restrict networks. I've been surprised that I expected over the last year I'd be hearing press stories, complaints from the consumers saying, I signed up for this bronze plan and now I can't go to see the surgeon that I want to. But are you seeing that at the ground level, those complaints, or has that not been an issue? I've always been just surprised by that. As an insurer, you'd be privy to that earlier than I would be.
Here's the difference. Back then, the average patient, the average person who paid the premiums, they didn't have nearly as much skin in the game. They didn't have to come up with 40% out of pocket. So they wanted a lot of choice. They wanted their specific doctor. And most people still do. They want their doctor, they want their hospital. But if the cost is going to be more, an extra $500 or $1,000 or $2,000, they're pretty willing to go to a different doctor or a different hospital. So that's one reason you're not getting that now. And you might say, well, why would the public ever take on more skin in the game from a financial standpoint? Well, that's the only way for them to enter into the system. And as we mentioned earlier, with the metal levels, and a lot of people have the silver or bronze, it's the only way they can afford it. They've got 30, 40% out-of-pocket costs.
Right.
So to them, you know, they're actually willing. They may think you're the greatest doctor in the world, but they will move to someone else.
Just to clarify, there has been a concern that They signed up for the plan because that's the one they could afford, but they didn't know that they were also signing up for a very small set of doctors. But what you're describing is that's not the case. They actually know what they're signing up for.
There are some very narrow networks out there, but I think in most cases, at least in New York State, in order to be on the exchange, you have to meet certain qualifications, and network adequacy is one of them. So it has to be relatively broad. Everything is in there. So I don't think that that's as much of an issue. Now, where I think it will become more and more of a concern as time goes on is if you've got a higher cost individual physician or a higher cost hospital, and they are left out of that network and they want to get back in, they're going to have some difficult discussions as to how they can bring down costs.
Right. So,
And isn't that part of the objective of this?
well, I think one of the